How can we be more advanced and competitive while making better profit margins? We can use the Neo. What is the Aerolase Neo, and how is it different, and how could it possibly drive revenue to our office, and how can we stand out by using yet another laser when we all have lasers sitting in a room or in a closet that we're not using, and here comes a new laser saying, yeah, we're the one. So I'm going to tell you right now about the Neo, which I've had now for only a couple of months, and I'm already buying a second. So this is it was a big investment for me, but certainly not as big as many of the other lasers. But it has absolutely revolutionized my practice, and I'm very eager to tell you about this. And interestingly, this does tie into the first part of the lecture, because as you'll see, they're going to all be the same, using the same national combinations of generic prescriptions. We can stand out by using something such as the Neo, which is new technology, and most importantly, it works. So we can have effective treatments for our common dermatologic conditions. We can have effective treatments for our common aesthetic conditions, all with one laser. And therefore, we can stand out and have profit margin. Most dermatology patients, interestingly, are seeing 3 to 5 different doctors before finding the one that solves their primary concern. So again, with all these competitors, how are we going to grow? Interestingly, consumers see cutting-edge technology. That's how they determine if a physician is highly qualified. For example, in my office, I have iPads. I have wall boards that are essentially computers. I have standing iPads that has advertisements going through them. And people just think that that is, wow, Dr. Harkaway, you are so, high tech. And you can see that for them, they don't really know that well, other than, potentially looking you up on the internet and seeing what are your scores or where did I go to school or things like that. But they look around and they see that as a sign of quality, as technology that they can infer makes me better than an average, let's say, dermatologist. The Neo, again, can be cutting edge technology, gives fast results that patients can see and feel. Loyal patients. And again, that's one of the things that we're looking for, given this new change in healthcare delivery. We want patients that know that you're not going to find this kind of thing at the Minute Clinic. The real medical people. Like, for example, that gentleman who had rosacea. Now, he had already been on a bunch of things. So he was happy to do it. He probably would have paid for it, because at this point, if you're treating rosacea, that's now a pocket expense to treat them with lasers or with this laser. To take someone who just has rosacea and you've never been treated with any medicine, I think it depends upon what else is going on with them. Once you can show them that, you know what, you're like that woman I was telling you about. She had acne, she had this, she had this. If I would take a woman in their 50s that has redness, some rosacea, some pustules, some lentiginous, and she wouldn't mind having her face tightened, then absolutely they would go for it. But sometimes I do think that we're going to have to discuss it with people. I can give you a prescription, but most of the times people are coming in, their primary's already given them something, and they know it doesn't work that well. They've had, rosacea is a chronic condition, so they've usually been around the block with this. It's not that often that I'm the first person to make the diagnosis of rosacea, let's just say.